Hello and welcome to abxtracker.com, the solution for antibiotic stewardship regulations within skilled nursing facilities. Today we're going to be going over the new antimicrobial tab on the menu bar, located right here. It is the second option from the left. The new antimicrobial tab is to be used in a couple different scenarios. When a provider comes to your facility and orders an antibiotic, or if a patient goes to a provider appointment and comes back with an antibiotic order. If a provider comes to your facility and orders an antibiotic, for instance, you open up the new antimicrobial tab and find the appropriate button to click on in regards to the potential infection type. You'll notice here that we have other options as well. To enter a new topical eye or ear antibiotic, enter an antifungal medication for tracking, enter an antiviral medication for tracking, and then we have our antibiotic tabs, buttons, which consist of UTI no catheter, UTI indwelling catheter, lower respiratory infection, upper respiratory infection, C. diff, other infection of nonspecific origin, and a skin or wound infection. So let's throw a scenario out there. Let's say you have a provider come to your facility and order an antibiotic for a UTI with an indwelling catheter. You simply go to abxtracker, click on New Antimicrobial, and enter by clicking the UTI with indwelling catheter button. Let's begin. When you click on the button, it'll open up a new form for you to fill out. Let's briefly fill this out. It starts with the patient's first name, last name, medical record number. Again, it is important to get this medical record number correct, the date of birth of the patient. Again, if they have a floor, a wing, a building, or a unit number, you'd enter that at the appropriate drop-down menus. Our room number, our bed number. Now, vitals are required for this particular form. Heart rate, respiratory rate, and temperature. Notice for those 4 vitals, no labels are required. Just the number is fine. Now we have our signs and symptoms that the patient had when the antibiotic was prescribed. Simply click on the appropriate signs and symptoms that the patient exhibited that resulted in a prescriber prescribing a medication. You can also add any other information you'd like to here. Next, was an antibiotic prescribed? Yes or no? Yes. Pick the date prescribed. For this instance, you do have the option to backdate. If a provider came over the weekend, ordered an antibiotic, and now it's Monday and you'd like to enter that, you can do that by clicking on the field and then indicating the date the medication was prescribed. In this case, I'm going to pick a couple days ago. Pick the medication prescribed, the dose of the medication, the route of administration, the frequency, and the duration. It is a diagnosis of a UTI, where it was acquired. If you are using this button, it is not going to be hospital-acquired infections. Again, if you're using this button in the new antimicrobial menu tab, you will not indicate this is a hospital-acquired infection. It will be a nursing home-acquired infection most of the time. Enter the provider's name that's prescribing the medication, and then click the Submit button. You'll notice that a pop-up window comes up. This is our electronic health record documentation. Please copy and paste over to your electronic health record system. You'll notice now that when we use the Antimicrobial tab, you will not see the patient's name under the pending orders or results pending table. This is because this is reserved for watch and wait infections, as well as any button you click under the Create S bar or watch and wait. Everything from the new antimicrobial goes directly to the 72-hour report as well as the outcomes. For our purposes, let's click on the 72-hour report and pretend now it is time for an antibiotic timeout. You'll notice here that we can find the particular medication that was prescribed. Here is John Doe on 1/11 that the medication was prescribed. We can now do our timeout by clicking the View hyperlink. We can see the medication he's on. We simply check, type our name. I have verified this information, indicating our timeout. And it should have fallen off the 72-hour report. In the future, abxtracker will expand the 72-hour report to walk facilities through exactly what a 72-hour or an antibiotic timeout is. Next is our last phase of antibiotic, which is our outcomes phase. Again, everything that you enter under new antimicrobial will go on the 72-hour report or the antibiotic timeout report, as well as the outcomes. Let's click Enter Patient Outcomes, pretending that the antibiotic is now completed. Under the Enter Outcomes, you can see the completed orders or outcomes pending page. You'll notice that John Doe is on the bottom. We simply click the outcome hyperlink to complete his outcome. Again, you can always reproduce any documentation by clicking on the appropriate spyglasses, as well as finding the particular instance under the Miscellaneous tab and the Historical S-Bars button. Let's finish John's outcome by clicking the outcome hyperlink. There are a number of outcomes to choose from, so please read carefully. For our purposes today, we're going to click Successful, Patient Symptoms Resolved. You can always type any other information here. Don't forget to add the appropriate medication stop date, as this is very important to calculate our days of therapy. Lastly, click Submit Treatment Outcome for tracking. You'll notice that another pop-up pops up with our electronic health record documentation. Again, copy and paste over to your electronic health record for documentation. You can then close out of the window. That is the last step in completing a medication order under the new Antimicrobial tab on the menu bar. Thank you.